Aciont has two non-invasive transscleral drug delivery platforms. One called Visulex P is used to deliver molecules passively, and the other is called Visulex I, based on iontopheresis, and enables the transport of macromolecules. We found that small molecules penetrate the eye effectively with a topical administration using our passive diffusion-based approach. Oh, next slide. My presentation today focuses on our Visulex P technology, specific to DSP-Visulex, a topical dosage form of dexamethasone sodium phosphate. I'll provide some background on our preclinical work before discussing our first in-human study in the treatment of non-infectious anterior uveitis. Next slide. This video shows how our DSP-Visulex system operates. Here we see the drug being loaded into our drug matrix, which does an excellent job in optimally retaining our drug solution. The applicator wears like a scleral lens with a self-adhering mechanism, allowing the eye to move freely while maintaining the drug matrix on the eye, thereby optimizing transscleral drug delivery. Next slide. Next slide. This MRI shows how small molecules can penetrate the eye transsclerally from a topical administration. Here we show how much dexamethasone can be delivered to each section of the eye within a 5-minute treatment. This MRI appears to illustrate drug distribution through the so-called suprachoroidal space. Next slide, please. We tested our 5-minute treatments in a chronic panuveitis model to use successfully for evaluating steroid implants over 30 days. Weekly DSP-Visulex treatments were tested against a non-treatment control. As expected, the control group shown in the red line of this graph show high inflammation scores in the vitreous throughout the study, whereas both DSP-Visulex groups worked effectively and resolved within 2 to 3 treatments. Next slide. This histopathology showed clear differentiation in the retina choroid inflammation among the treated and untreated eye groups. On the image on the left, you can observe that the severe inflammation model completely swelled and damaged the retina, whereas it was well preserved in the treated eye example on the right. Next slide. DSP-Visulex is well tolerated in the various animal models. We do not see any IOP increases over the 3 months of weekly dosing. Upon careful examination following treatments, we only observed slight transient IOP increases, which resolved within an hour. Next slide. Our 201 was a double-mask phase 1-2 clinical trial. Next slide. 44 patients were randomized into 3 groups, which included our low and high-strength 5-minute DSP-Visulex treatments, using Pred Forte 1% as the positive control. While Pred Forte employs 6 drops per day over 2 weeks before tapering, DSP-Visulex employed 4 or 5 treatments in the clinic. Patient compliance can be a key benefit. Next slide. Primary endpoints were based on clearing up of cell counts in the anterior chamber, which are illustrated on the y-axis of this graph over time. Both DSP-Visulex groups appear to have similar efficacy with the positive control. At the end of the 28-day study, approximately 90% of the patients in the DSP-Visulex groups achieved AC cell counts of 0, compared to about 80% of patients in the Pred Forte group. Next slide. There were no treatment-related serious adverse events in the study. The 8% DSP-Visulex and Pred Forte control group similarly had 2 treatment-related adverse events. While the 15% DSP-Visulex group had more adverse events, this higher percentage is consistent with observations using the standard of care shown in other clinical trials. The most commonly reported local ocular issues are minor corneal abrasion and eye pain, all of which were resolved within the study's timeframe. Next slide, please. The mean change of IOP of patients in the Pred Forte group, as shown in the green line of this graph, increased significantly and remained constant above baseline. In contrast, while the IOP of patients in both DSP-Visulex groups appeared to slightly increase and transiently within the 2 days following treatment, they consistently returned to baseline with each weekly reading. DSP-Visulex appears to optimize the efficacy of steroid therapy while significantly mitigating unwarranted IOP increases. Next slide. DSP-Visulex potentially can treat a wide range of intraocular inflammation indications beyond uveitis, such as macular edema and postoperative inflammation and pain. Steroid treatment without increasing IOP is potentially a distinguishing feature of our approach. Also, both our drug compositions and delivery system have passed long-term stability and sterility tests. Next slide. I'd like to just talk a little bit about our iontopheresis technology. Next slide. Our preclinical studies show that we can deliver safely a significant amount of the Avastin drug into the eye and it in therapeutically relevant amounts. This was demonstrated by successful rabbit PK and CNV efficacy models. That all being said, we're here today because we're interested in potential collaborations. If this interests you, let's meet and talk today. Thank you very much for your time.